Today is March 5th, 2021. In this video, I would like to talk about some of the differences between the different vaccines. I've made several videos talking about the vaccine distribution process and how many people so far have gotten vaccines. I also made videos in the past talking about new vaccines that got approved. For example, when the Pfizer vaccine first got approved by the FDA, I made a video talking about that. And more recently, when the Johnson & Johnson vaccine was approved by the FDA, I also made a video talking about that. So I've talked about these different vaccines here and there, but I've never made a video devoted specifically to talking about these differences. So I think now is a great time to talk about it, since now in the United States there are three vaccines available for people to get: Pfizer, Moderna, and Johnson & Johnson. But there's also another vaccine that's available in some other countries, but not the United States, and that's the Astrazeneca vaccine. For whatever reason, I'm not sure of the exact reason, the United States has not approved of the Astrazeneca vaccine, but other countries have done so. So the United States has three vaccines now, recently became three. Previously it was just Pfizer and Moderna, but I made a video the day it happened. It was around a week ago or so when the Johnson & Johnson vaccine got approved by the FDA. But in total, there are four major vaccines that have been approved by some countries across the planet. So the four major ones are Pfizer, Moderna, Johnson & Johnson, AstraZeneca, like I talked about. The Pfizer and Moderna vaccines, they are both mRNA vaccines, and this was actually a pretty new innovation. So that's what's kind of surprising about these. The mRNA vaccine hasn't really been done before. That's not usually how vaccines are created. So the fact that they were able to create an mRNA vaccine in both the Pfizer and Moderna vaccine, pretty impressive. These were also the first two vaccines to be approved of by the FDA in the United States for the past couple of months. Up until last week, those are the only two vaccines available for people to get: Pfizer and Moderna. Now we have a third vaccine, but that only happened last week. In the trials, in the phase 3 trials, the Pfizer vaccine was shown to be 95% effective at preventing illnesses associated with COVID-19. So Pfizer had a 95% efficacy rate in the clinical trials. Moderna had a similar rate. Moderna was around 94% effective in the trials in terms of preventing illnesses related to COVID-19, but it's worth noting that these efficacy ratings may not account for mutations in the virus, especially the new B117 mutation. That's the mutation that originated in the United Kingdom, most likely. We don't know for sure where it truly originated, but that's where it first started emerging pretty rapidly in the United Kingdom. But it's in many other countries now, and it's predicted to be a dominant strain in the United States very soon, in just a few weeks from now. So it's definitely important that we can deal with the B117 strain, since that's going to continue to be more and more dominant in the upcoming weeks. That's also a topic that I plan on making a video about potentially. I don't know if I have enough info on the mutation to make an entire video about it. I'm still not sure at this point, but that's definitely something that the vaccines need to be able to target these mutations. So I don't think the 94 and 95% for the Moderna and Pfizer vaccines respectively necessarily take into account this B117 mutation. I think these trials were done before that mutation became prevalent. But newer trials, more recent trials, have shown that the vaccines are at least relatively effective at targeting this mutation, the B117 mutation. However, it's likely not as effective at targeting the B117 mutation as it is targeting the prevalent mutation in fall 2020. So that was kind of a long tangent, but I was basically talking about the effectiveness, the rate, how effective these two vaccines are. Now, for the Johnson & Johnson vaccine, it was shown to be slightly less effective than Pfizer and Moderna. Johnson & Johnson had an 85% effectiveness rate at preventing COVID-19 with serious illness, and a 66% effectiveness rate at preventing any symptoms at all due to COVID-19. So it's not as high of a rate as Pfizer and Moderna, but it's also worth taking into consideration the fact that the Johnson & Johnson trials were done after Pfizer trials and Moderna trials. Johnson & Johnson got approved a lot later than the other two, which means that it's a lot more likely that these trials included patients that got the mutated virus, the B117 strain, or even some other strain of COVID-19, some other mutation. So that could be one of the reasons why Johnson & Johnson has a lower efficacy rating than the previous two vaccines that I just talked about. Like I said, the Pfizer and Moderna vaccines both are mRNA vaccines. However, the Astrazeneca and Johnson & Johnson vaccines work in a slightly different way. The Johnson & Johnson vaccine, basically, this vaccine uses a modified adenovirus to enter the cells, which allows the body to create antibodies that can fight against COVID-19 viruses, or coronaviruses, I guess, be the proper term. COVID-19 is the disease associated with coronavirus and caused by coronavirus. I don't want to mix up the terms. And then for the AstraZeneca vaccine is pretty similar in that it also utilizes an adenovirus that's modified to target coronavirus specifically to prevent the patient from getting COVID 19. Like I said, COVID 19 is the disease, coronavirus is the virus specifically. One difference I think that's worth noting between the Johnson & Johnson vaccine and the other vaccines is that the Johnson & Johnson vaccine actually only requires one dose. I've talked about this before. I talked about this when it first got approved, but Johnson & Johnson for this vaccine, the patient only needs to receive one dose of it and that's all they need. But for the other vaccines, for Pfizer and Moderna both require the patient to receive two separate doses, and in between those two doses, the patient has to wait several weeks. For Pfizer, the patient has to wait 3 weeks between the first dose and when they receive the second dose. And for Moderna, the patient has to wait 4 weeks between when they receive the first dose and when they receive the second dose. So it takes longer for people to get vaccinated with Pfizer and with Moderna, and it also requires more doses because each patient needs two. But with Johnson & Johnson, it's just a one-time shot, that's all. And also only need half as many doses to vaccinate the same number of people, since each person only needs one vaccine for Johnson & Johnson, whereas Pfizer and Moderna both need two. Now, the age limit for these different vaccines actually differ a bit. The thing about these vaccines is that they haven't really been tested much in children, in young people. I guess one of the reasons why children weren't prioritized is because generally younger people have a less likely chance to either get severely ill from COVID 19 or pass away from due to COVID 19. And because people who are not adults, who are children, have the smallest chance of getting severely ill or dying from COVID 19, I guess they were not prioritized in the vaccine trials, and people above the age of 18 were prioritized in the vaccine trial. Adults were prioritized, especially elderly patients. The vaccine needed to make sure the vaccine companies needed to make sure that the vaccines were effective in elderly people, especially since these are the people most likely to get severely ill due to COVID 19 and most likely to pass away due to this virus. That's also why Phase 1B includes people above the age of 65, regardless of whether or not that person has any underlying health conditions. But if you're not above the age of 65, then you have to have a health condition in order to receive the vaccine as part of Phase 1B. Pfizer has a minimum age of 16, while Moderna and Johnson & Johnson both have a minimum age of 18. If you're under the age of 16, you can only take the Pfizer vaccine, and if you're under the age of 16, unfortunately, there's not a vaccine available for you at this time, but trials will be done in the upcoming months for children to make sure that the vaccines are also safe for younger people to take, as in people under the age of 18 and 16. I do think though that it's very important that children also can get vaccinated as soon as possible, even though they aren't as likely to die from the virus or get severely ill from the virus. It doesn't mean it can't happen. Yes, it's less likely, but I'd rather there being a very small chance than just a small chance of these people getting severely ill due to COVID 19, even if they are younger. The other thing is that children can also spread the virus to other people. Children can spread the virus to older people, and if there's an older person that hasn't been vaccinated yet, and then a child ends up spreading the virus to that older person, then that could potentially cause the older person to get seriously ill or unfortunately even pass away. So it's important to also vaccinate the children because they can also spread the virus if they're not vaccinated. Even if they get the vaccine, they'll still be able to spread the virus somewhat, but it'll not be nearly to the extent that they would spread it without the vaccine. And that's the main reason why I think that children need to be vaccinated as soon as possible, even if they're not at high risk from getting severely ill due to COVID 19. So, like I said, the vaccines are only available for adults. Pfizer, Moderna, and Johnson & Johnson all are not available for children yet. Moderna and Johnson & Johnson, both of those require you to be 18 years old or older, but for Pfizer, the minimum age is 2 years younger. Pfizer only requires you to be 16 years old in order to be able to receive it, which means that 16-year-olds and 17-year-olds can receive the Pfizer vaccine, but not the Moderna vaccine, nor the Johnson & Johnson vaccine, and people under the age of 16 cannot receive any of the three vaccines just yet. People above the age of 18 are able to receive any of the three, obviously, since 18 is the minimum age for two of them, and the other one, 16 is the minimum age. The final difference between the different vaccines, the different COVID-19 vaccines that I think is worth talking about, is the temperatures at which they need to be stored at. It turns out that the Pfizer vaccine has to be stored at a much colder temperature than the Moderna vaccine and the Johnson & Johnson vaccine. The Moderna and Johnson & Johnson vaccines both require a storage temperature of 2 to 8 degrees Celsius, 2 degrees Celsius to 8 degrees Celsius. As an American, I am not familiar with the Celsius system of temperature. I'm more familiar with the Fahrenheit system of temperature, but 2 to 8 degrees Celsius is just 35.6 degrees Fahrenheit to 46.4 degrees Fahrenheit, so it's a little bit above freezing temperature. Freezing temperature of water, I mean, because freezing temperature of water is 32 degrees Fahrenheit or 0 degrees Celsius, so this is a little bit above that. 2 to 8 degrees Celsius, 35 to 46 degrees Fahrenheit, so it's not really cold, but it's still pretty cold. So that's for the Moderna vaccine and the Johnson & Johnson vaccine, the 2 to 8 degrees Celsius temperature for storage. But the Pfizer vaccine, that vaccine requires a much colder temperature to be stored at. While Moderna and Johnson & Johnson are both a bit above freezing temperature at 2 to 8 degrees Celsius, Pfizer is much lower than that. The recommended storage temperature of the Pfizer vaccine is negative 70 degrees Celsius. That's way below the freezing point of water. Negative 70 degrees Celsius is equivalent to negative 94 degrees Fahrenheit, so this vaccine requires really cold temperatures for its storage. This makes the Pfizer vaccine a lot harder to store than either the Moderna vaccine or the Johnson & Johnson vaccine. I mean, 2 to 8 degrees Celsius, 35 to 46 degrees Fahrenheit, that's around what the temperature is inside your refrigerator. Like your refrigerator that might be there in your kitchen, inside there it's around 35 to 46 degrees Fahrenheit, more or less. So it's not that hard to store the Moderna and Johnson & Johnson vaccines at those temperatures. 35 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius, that's just a relatively cold day outside. Those temperatures are not that hard to create. Moderna and Johnson & Johnson, it's not that hard to find the right temperature to store these at, but the Pfizer vaccine, negative 70 degrees Celsius, negative 94 degrees Fahrenheit, that's way colder of a temperature than what you would even find naturally in the South Pole, in Antarctica, at the bottom of the planet. Even there you wouldn't find temperatures as cold as negative 70 degrees Celsius or negative 94 degrees Fahrenheit naturally. Those are temperatures that can only be created artificially, and those temperatures are much harder to create than 2 to 8 degrees Celsius or 35 to 46 degrees Fahrenheit. So storing the Pfizer vaccine is a lot harder than storing the Johnson & Johnson vaccine and storing the Moderna vaccine because of the extreme temperatures that storage of the Pfizer vaccine requires.